Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about some of the exercises I like to use for the functional activity of sit to stand. But before I begin, please hit that subscribe button below so you'll be notified about any new videos I have here on my channel. So essentially, when I'm teaching somebody to do a sit to stand activity, the first thing I like to incorporate is actually a band, and this is actually a Thera loop. And essentially what we want to do with this is it's a helpful way to activate and isolate some of the glute muscles, the glute med muscle in particular, when somebody's doing this particular activity, which can be helpful in terms of their support, right, for that sit to stand movement. So first thing I'll have the patient do is actually place the band just above the knees, right? And then I'm going to essentially mention to them to keep that, keep sort of a hip distance apart and maintain this as they're coming up. And then depending on the patient's strength, they might have to use a bit of support, so they might have to essentially use the armrest for a little bit of support initially. And then I'll just have the patient use their momentum, right? So leaning forward and then pushing up with their arms in order to go from that sit to stand position while maintaining the resistance on the band. So it's going to look something like this. Now, once the patient feels comfortable with that, I'll have them place their hands just on their thighs, right? And then again, trying to do the same thing without the support, and then perhaps also with their arms out in front. This is a great way to progress from more support to less support, and then from there it might look like doing a little mini squat or without even having the chair there. So great little way to isolate the muscle that's required for this movement. Great way to progress from more support to less support, and it's a fantastic functional exercise for patients. Please make sure to check with a physiotherapist to make sure that this exercise is appropriate for you. And thanks again for watching. Please leave a comment below if you have any questions or concerns, and have a great day. Thanks again.